report is about hives, also known as urticaria, and the learning outcomes of our report is to identify what are the causes of hives and what are the symptoms of hives and how to diagnose urticaria and how to treat at home some home remedies for urticaria. What is hives? Hives is an outbreak of swollen red bumpy rash that appears on the surface of the skin, either as a result of the body's reaction to the allergens or unknown reason. Hives can also be extremely itchy and spread across large area of your body. They may also burn and sting. They can appear anywhere, including ears, arms, fingers, legs, feet, anywhere. And it can also last for a week or days. It depends how severe your hives are.
What are the causes of hives? Hives are usually caused by an allergic reaction to something that you have encountered or swallowed. When you have an allergic reaction, your body begins to release histamines into your blood. Histamines are chemicals your body produces in an attempt to defend itself against infection and other outside intruders. Unfortunately, in some people, the histamine can cause swelling, itching, and many of the symptoms that are experienced with hives. In terms of allergens, hives can be caused by factors such as pollen, medications, food, animal dander, and insect bites. People who are known to have allergies are more likely to get hives. You may also be at risk to develop hives if you are on medications or if you are unknowingly exposed to things you may be allergic to, such as food or pollen. If you are already ill with an infection or a health condition, you may be more vulnerable to developing hives. What are the symptoms for urticaria? The most noticeable symptoms associated with hives is the welts that appear on the skin. Welts may be red, but can also be the same color as your skin. They can be small and round, ring-shaped or large, and of random shape. Hives are itchy and they tend to appear in batches on affected part of the body. They can grow larger, change shape, and spread.
Here are other symptoms of urticaria: patches of red or skin-colored welts, raised itchy bumps, either red or skin-colored, bletching. When pressed, the center of a red hive turns white, welts that vary in size, shape, and color, painful swelling or angioedema of the lips, eyelids, and inside the throat, dizziness, difficulty in breathing. Short-term or acute hives often appear suddenly and clear up within a few weeks. Chronic hives, on the other hand, may be related to an underlying illness such as thyroid disease or cancer, so they may stay for a longer period of time.
In some cases, the trigger is obvious, like when a person eats peanuts or shrimp and then breaks out within a short time. Other cases require investigation by both the patient and the physician because there are many possible causes. If the hives have gone on for a long time, the cause is not usually identified. Your allergist may want to conduct skin tests, blood tests, and urine tests to identify the cause of your hives. If a specific food is a suspected trigger, your allergist may want to conduct skin prick test or a blood test to confirm the diagnosis. Once the trigger is identified, you'll likely be advised to avoid that food and products made from it. In rare instances, the allergist may recommend an oral food challenge, which is a carefully monitored test in which you'll eat a measured amount of the suspected trigger to see if hives develop. If a medication is suspected as a trigger, your allergist may conduct similar tests and a cautious drug challenge, similar to an oral food challenge but with medications. Because of the possibility of anaphylaxis, a life threatening allergic reaction, these challenge tests should be done only under strict medical supervision with emergency medication and equipment at hand. In cases where vasculitis, the inflammation of the blood cells, may be the cause, your allergist may conduct a skin biopsy and send it to a specialist to examine under a microscope. Since hives are formed because of the body's production of histamines, antihistamines like cetirizine are often recommended to provide relief from the symptoms. When histamines don't provide relief, oral steroids may be prescribed. Severe episodes of urticaria may require temporary treatment with prednisone, a similar corticosteroid medication or an immune modulator which can reduce the severity of the symptoms. If the reaction involves swelling of the tongue or lips or difficulty in breathing, cortisone medicine or epinephrine autoinjector is prescribed for you to keep at hand at all times. These can be early symptoms of anaphylaxis, a potentially fatal allergic reaction that impairs breathing and can send the body into shock. The only treatment for anaphylaxis is epinephrine.
In the majority of cases, people use home remedies to treat hives and do not seek further medical attention or intervention anymore. Effective home remedies to treat hives include a cold compress. A person can apply a cool, damp cloth to the affected area. This can provide relief from itchiness and help reduce inflammation. A cold compress can be used as often as necessary. Bathing in an anti-itch solution. Oatmeal and baking soda baths can soothe skin and reduce irritation. Adding witch hazel to a bath is another effective home remedy. Also applying aloe vera and essential oils. The healing properties of aloe vera and essential oils may soothe and reduce hives, but it is advisable, however, to do a skin test before applying this to the entire area that is affected. We should also avoid irritants. This includes perfumes, fragrance soaps, moisturizers, and staying out of sunlight. A person should also stay cool and wear loose, comfortable clothing. While the symptoms of hives can be very irritating, there are many ways to treat or soothe and get rid of hives. Chronic hives don't put you at any sudden risk of a serious allergic reaction they call anaphylaxis. Simple changes to your lifestyle may be able to help you prevent hives from reoccurring in the future. If you have allergies and you know which substances are likely to cause an allergic reaction, your doctor will suggest that you avoid any possible exposure to these factors. Allergy shots are another way option that may help you reduce the risk of experiencing hives again.